Yeah, this is a paper from Hunter et al. About implementing a mental health intervention in low and middle income countries. It's about the question whether it's all about resources or whether there are other important factors. My name is Heiner, consultant psychiatrist and editor of the journal Global Psychiatry Archives, and I'd like to explain some of the important papers. And in this kind of paper, you will understand what's going, how it has been analyzed, and what the problems are against implementing, and what are the resources to make this implementation of this specific intervention happen. Okay, let's start with that. And so this is a focus group of 25 clinicians and 23 patients, and they discuss the implementation of a specific therapeutic app, which is called Dialogue. I will show you in a bit. And the Dialogue is more or less, this is a screenshot. It's a way of conceptualizing mental health, physical health, job situation, accommodation, leisure, partner, family issues, friendship, personal safety, medication, practical things and meeting things. And they try to focus on individual things in a structured way. And I show you the next screenshot. And, so in every different part, like job, there's a question of how do you understand the problems? How do you work on this? What's the best case scenario? What's the smallest improvement? Consider the options and then agree on the actions. So the question is more or less, how is this type of dialogue plus system to be implemented? And there had been quite a few studies on this. And here, these studies have been performed in Bosnia-Herzegovina, Kosovo, Northern Macedonia, Montenegro, and Serbia. They all have very similar hospital-based psychiatric systems, which have routine meetings, from 1 to 3 months, and the other clinicians like psychologists, psychotherapists, social workers, and others involved in the treatment. Right. So during this dialogue, they have during this dialogue implementation, they have discussed all the problems, and this is here. It's a summary of the problems. There's very detailed analysis. So the problems against the implementation was clinicians factors, limited to times for sessions, difficult working with acutely psychotic patients. There was the barrier for the patients was that they were more concentration when engaging with a structured interview, and they found it sometimes a bit feeling tense and difficult. So what would help and what was helping on the clinician side, if there was a positive willingness to deliver the intervention. So if other colleagues were feeling positive, the working with the intervention and what is positive about that, and the hope and belief on the consequences. On the patient side, it was willingness to engage with the intervention, the support by peers, the emotional side during an intervention, and believe about the positive consequences by having a bit more of a structured interview. There was this theoretical domains framework to analyze the problems. There are quite a few interesting comments. So the question were, so let's say sometimes I found it difficult at the beginning. So that's an example. Yes, I did the first session badly, but then later it was going better. So these are things which have been analyzed, and I'd like to come to the conclusions, which I hopefully haven't missed here. The conclusions were more or less here, that the limited resources are a problem in the mental health care setting. And time was a big problem. but usually many of these barriers could be overcome looking carefully at what's possible. So the intervention, which was then discussed, the dialogue intervention, so that's a more or less a structured approach to individual problems patients may have, would be possible if there would be a positive engagement with that. Okay, that's more or less the essentials. Thanks for listening. And if you want to read the paper, you can go to globalpsychiatry.co.uk. And if you're interested in further videos, please subscribe to our channel, which is on YouTube, Global Psychiatry Archives. Thanks for your interest and have a nice evening. Bye-bye.